Thank you very much, Mr. Chairman. You know, and we're prohibiting HHS from finalizing, implementing, or enforcing this rule or any other similar rulemaking that would restrict the use of TANF for pregnancy centers. But Democrats here are arguing that Republicans don't care about children after they're born. Yeah, up until crowding. Yet this proposed rule would strip crucial resources from families offered by pregnancy centers. You know, and I'm not going to apologize for supporting a, quote, pro-life bill, but I will totally take problem with the previous speaker saying that this is only about birth, that this is not about pro-life. This is only about concerns of holding a mother captive for pregnancy. This is absolutely not. Perhaps the gentle lady actually needs to do research on some of the resources.
Would you like me, would you yield?
Excuse me, I have the floor. No, I will not yield.
Well, then don't talk about me then.
I have the floor, I will not yield.
Don't mention me if you won't
have
yield.
the floor and I will not yield.
She has not yielded.
You're accusing me of things that aren't true.
I was just repeating
Stuff I didn't say.
what you said.
The gentle lady does not yield. She has the floor.
Democrats are arguing this question. The fact is that if they actually did their research and they found the services that are provided by pregnancy centers, you would see things like maternity and baby clothing, formula and diapers. I don't know about you, but I don't know how many children in a womb actually need formula and diapers. Unplanned pregnancy, childbirth, and parenting classes. You need to parent for a child who has been born, not for one that is in the womb. Adoptive information. To be able to take the baby that is born healthy, and make sure that they've got parents that want them. Looking at assistance for education and career decisions. Training and life skills. Housing and support services. Those are all services offered by pregnancy centers that Democrats want to cut. They sit here and they say that these centers are actually decreasing the number of choices available for women. That is absolutely not correct. You are taking away the choices that women have by having these birthing centers and wanting to cut their funding. And Texas has about 200 pregnancy centers. California has at least 176 pregnancy centers, and at least 5 states distribute a portion of their TANF funding to pregnancy centers, including Indiana, Louisiana, Missouri, Ohio, and Pennsylvania. 18 states, including Texas, have authorized state funding for pregnancy centers. In 2023, the state legislature approved $165 million over 2 years for pregnancy centers through its Alternatives to Abortion program, more than double the 2019 budgeted amount. It's important that states have the option to use TANF funds to support programs that not only provide these resources, but they're providing them at no cost. This reduces the dependence on the federal government. Maternal mortality is a problem in this country that disproportionately affects Black women. According to the Centers for Disease Control and Prevention, in 2021, the maternal mortality rate for Black women was 69.9 deaths per 100,000 live births, 2.6 times the rate for white women. In 2022, CareNet network of 1,200 affiliated pregnancy centers provided invaluable prenatal and postpartum services to 334,294 clients, 47% who identified as people of color, including 80,231 clients who identified as Black and 66,859 clients who identified as Hispanic or Latino. In comparison, in 2019, Planned Parenthood stated 39% of their patients identified as persons of color. We should be supporting organizations that provide prenatal and postpartum services to people, not restrict them, as this is an all-hands-on-deck situation. Democrats' proposal to strip funding from pregnancy resource centers will only serve making minority women's lives harder. And with that, I yield.